I'm sitting in this space. Tell us where we are, because I know when kids have to deal with things, it's tough. And it sounds like this is a place that just makes it maybe a little easier.
That's exactly what this place is designed for. We're in the Hale Roof Garden on the 10th floor of the Hale building. The cardiac ICU that I work in is 2 and 3 floors below us, because we cover 2 floors, our cardiac ICU. And we need spaces like this for families to be able to step away and really, think and decompress. And for staff, these are very challenging, complex patients that we're taking care of in this building. Our neonatal intensive care unit is here. Our cardiac ICU is here. We have operating rooms in this building. There's a lot of, the cath labs are here. So it's wonderful that we can have these magical spaces where you can just feel that you're in a pediatric hospital and there's a place to relax and think.
Can I just say, it's like you're sitting on a tree, like a tree bench. There's I don't know, is this a rainbow? It feels like above us. It's pretty cool.
Carol mentioned the energy that we feel when we walk into a space such as Boston Children's, and we're reminded that it's not just a teaching hospital, a research hospital. It's also a place that treats kids from really all over the world. I'm wondering how you prioritize where resources go, whether it goes to treating patients right now versus thinking about research, thinking about development, thinking about ways to actually help patients in the future versus working with them right now. How do you allocate those resources?
Well, that has always been part of the DNA of Boston Children's Hospital. It's been our mission. We deliver the highest, best quality clinical care. Really, that is the foundation of it all. And you see that, the motto of where the world comes for answers. There's a lot of complex patients from the Boston area, Massachusetts, New England. Obviously, we provide primary services for all levels of care for children in this community. However, there are many from across the United States and across the world who really seek that type of care and come to us, usually the most complex cases. And I think that's really where we thrive. And the other piece of our DNA is the science. We, as you talked in the beginning,
that makes a difference, right? When there's science involved, I feel like it's practitioner. Yes, you're dealing with patients, but it's people who are like, I want to understand how this works.
That's everybody here.
Yeah.
That's the doctors, that's the nurses, that's the social workers, that's the physical therapists, that's the respiratory therapists, it's the pharmacists. I just could keep going. So I think that's what draws people to work here and to stay here, because that purpose, that we're going to actually change things and we're going to be able to find newer ways of doing things. We're going to help more children survive, but also thrive. And that takes a real concerted effort. And you need the science here with the clinical.
One of the things I think when you joined Tim and I back in New York, and listen, everybody's talking about AI, and I know that. But I think we all are thinking about what it could do for medicine and R&D and innovation. And I guess what we're trying to understand, too, is what's the reality of what AI is used within the medical community or R&D specifically? Like, where is it today? And you, as someone who understands this space so well, and I'm curious the conversations you guys have, where do you think it could go?
Well, AI has been a very important part of Boston Children's Hospital for a long time. This isn't something new. We have incredible research groups and an incredible innovation team here who've been really standing up AI initiatives for a very long time. We talked about some of the work I personally have done in terms of, Virtue Foundation and the global health AI mapping and being able to match resource and need.
You work with firms that are specifically in AI.
Yes, with Databricks and DataRobot, right. We're building those real platforms that people can use. But I think about, for example, when ChatGPT first came out, we had Boston GPT. Immediately we were looking to get that behind our firewalls. How can we integrate that? How can we use that for real purpose in improving both the care that we can get to patients, but how can we use AI to also discover new things? I think the levels of data that we have, and I think you talked upon in the beginning, in terms of rare diseases, genetic diseases, we are the epicenter of that, and we've already been extremely successful in bringing new therapies to market for children. But when I look at the infrastructure that we're building, and I think you've had Dr. Wendy Chung come and speak, and she's heading up a lot of that work, I think our best days are ahead of us, and the AI is unlocking that type of potential.
I like hearing that, the optimism about our best days being ahead of us. And I think about just even during your career, how much treatments have changed in a pretty short time. I'm curious about the connection between kids and adults and, treating children. And of course, if kids are healthy, then they turn into healthy adults. But this is a children's hospital that does a lot of research. It does a lot of teaching also. Are there learnings that can be taken from what works with kids and even applied to a larger population, as not just those kids grow up, but as adults also need treatment?
I think there's 2 points that strike me there. One is that the decisions they were making early in life have long-term impact. It's something I've thought about my entire career in the cardiac space and in cardiac intensive care. The decisions to have surgery on day 2 or day 4, the decisions to use this drug or that drug, all of those things are shaping your long-term self. But it was very hard to be able to look at and analyze that type of data until you've opened up big data, AI. So I think, again, along the lines of our best days are ahead of us, that we're going to be able to see so much more through that. And then you said the innovations. Now, many patients that I took care of are adults, right? We have this huge growing adult population that we provide care for. Science that's discovered here, it's in a pediatric hospital, but it's bringing forth therapies that are actually treating adults. So I think it's incredible to see how this innovation engine drives so much.
If you could change one thing, just got about 30 seconds, if you could change one thing in terms of the work that you guys are doing and the R&D that would maybe make it easier, what would it be?
Make it easier?
Okay, bad word. If you could change one thing, though, that would help you guys in what you're working on. It sounds like you don't need, it sounds like you've got a great team. And
we have a great team, but we're always needing, support and engagement, and we're just trying to drive the next level, and partnerships to move in that direction. We are the leading children's hospital, so we're doing well, but we're always trying to push the envelope of what we can do.